welcome to the video. Today we're going to examine how to do flexiVent to look at in vivo lung mechanics in mice. So first we're going to set up the program. We're going to put the module in. So plug this in like that, connect the Y tube, and then take the cord from the AeroNeb lab and plug it right into the side of there. Nice and snug. Okay, then we're gonna press OK on the program. And you can see it's doing its work on the bottom. We're gonna add our mouse. Let's call it ABC. Always add a weight, let's say 20 grams. And then group membership. You want to do either control group or experimental group. Okay, so we're going to add all of our subjects, weighed, and a lot of times I like to just mark the tail with a marker to differentiate mice in the same cage. It makes it a lot easier when you're actually doing this procedure. So right now it's doing its calibration on its own. We're going to do our part in just a second. So right now we're going to prime the AeroNeb. We're just going to add 50 microliters of water to the AeroNeb. And you want it to cover that black ring with liquid. So you see, you want it to just cover nicely there. And what that does is it creates a seal so that we can calibrate. Okay, and next we are going to do the calibration with the manometer. So check all these three off. Press next, and we're going to leave the first one open to atmosphere. So put a nice clean cannula on, let it take the reading. Now we're going to hook up the manometer and apply 300 millimeters of water worth of pressure. Nice red liquid, looks really cool. Tell them the reading. You want these two values to be within about a half of each other, so that's fine, 79.5 and 79.9. Okay, we're just going to repeat that one more time. So one open to the atmosphere with the cannula on, and one more reading with the manometer. That checks out, that's pretty close. Okay, so now we're going to do the characterization. So once a month you have to take the nebulizer off and weigh it. We're not going to do that, we've done that recently. So we're going to enter the known values. Known values should be 0.05 liters per minute and a delivery ratio of 200%. The calibration is complete. Now we have to do the tube calibration. So make sure all four of these are checked off. We're going to use all four of them. We're going to reattach the cannula, do closed preparation. So cover the cannula with your thumb like that. Okay, now we're going to do open preparation, leave the cannula on, let it take the reading. Just a little side note, we keep our electrodes in PSS to try to simulate physiological conditions. So after the tube calibration, you should see these four symbols like that, and it's got that blue line. If there's a red X through it, you have to redo the tube calibration. Typically, the red X means that something went wrong here, or more often, the nebulizer does not have a seal. So at this point, we're ready to start our flexiVent procedure. We're not going to show it, but this is what the surgery area is going to look like. You have your absorbent pad, surgery pad with a mat on it. Our tools, you can use curved forceps or straight forceps, totally your preference. A lot of these details you can kind of do to your liking. It doesn't have to be one way exactly. Agar dish and our cannulas. So what we're going to do is we're going to anesthetize the mouse using your procedure. Do a toe pinch to ensure that it is properly anesthetized. And then what you do is you can use the pins or you can choose not to. It's also your choice. Turn the heat lamp on and make an incision from the bottom of the chin down to the sternum. And you're going to expose the trachea by pulling away at the thymus. Expose the trachea because it's going to be in like a kind of skin sac. You have to cut away at the tissue and really expose it, and then expose behind it. And you're going to take the surgical suture, snake it behind the trachea, and just make sure that it's under the trachea but sticking out. And then you have to be quick about this part. So you're going to take a cannula, quickly make a incision with the smallest micro scissors in a hole in the trachea, and then insert the cannula, tie the surgical suture, securing the cannula to the trachea, and quickly transfer the surgery platform over here. This won't be there. Put like this, and very carefully secure the cannula to the machine without pulling it out of the trachea. And then you're going to start default ventilation. And the reason you do it so quickly is once you cut the trachea, the mouse can't breathe on its own, so we have to quickly get it to the flexiVent because we want it to survive through the procedure. Okay, now the vent is going for the mouse. We're going to do an intraperitoneal injection of pancuronium bromide or whatever muscle relaxer you're using, and give it 5 minutes for that to take effect so that the vent is doing all the work and the mouse isn't using its accessory muscles to resist the ventilation. Now we're going to take a baseline, so we're going to do a deep inflation, a snapshot, quick prime, and PVSP, and you do that until you get 3 data points that are very close to each other. And that was a good example of what not to do. Don't click it too fast because it just took 2 quick primes twice. So make sure to give it its time and select the correct program. Alright, and then we can see the trend view. This is the data points. And then after you get to 3 good baselines that are near each other, you want to select mouse inhaled dose response. And it's going to do some sort of program before you actually add the contractors. Okay, so now we're going to add our contractor. And in our case, we're using methacholine. Take a chem wipe, remove the water from the nebulizer, make sure it's nice and dry. We have our vial of methacholine here. Take 50 microliters and add it to the nebulizer just like we did before. Enter the concentration and press OK, and it's going to nebulize that into the mouse's lungs and give you some nice data points. Alright, so you've finished all of your doses on one mouse, and you can press cancel after the program's done its thing. Then to stop ventilation, you just right click on mouse default CMV, click stop task, it will stop venting. You can take that mouse off the machine, and all you need to do is go to edit site assignment, and you're going to send this one that you just did over to the left, and that will send its data over there. And then you can take the mouse from the right, press this right arrow, and it will send it over for you to take data on and do a flexiVent procedure on. Okay, when you are done with all of your mice, you're going to try to exit out of the program, and before you go, it will prompt you, wait, please clean. And you really should, because there's a lot of chemicals and moisture inside the machine, and you don't want it to rust out. It's very sensitive. So what you're going to do is you're going to take the Y tubing off, and you can even take this apart to rinse it. You're going to take this off just like I did, and we're going to go to the cleaning wizard. So we take this tube, we have some sterile water, and take like 40 mils, just enough to, soak the inside of the machine. Attach this tubing to the syringe, put it in the right side here. Okay, we're going to take another one of these tubes and put it in the bottom on the side. Like that. And you'll hear a click on for that one. Put that into a waste bucket. Oh, put it in a waste bucket. And now it's going to prompt you to clean. It's for some reason going to ask for 5 minutes of soaking. So send the water. And you're going to see it come out through this tube, and just push a little bit, and then save like the last 10 mils for soaking. So we're going to wait 5 minutes now. Okay, so now we're going to do the drying. Press start. It's going to start venting. Push the last little bit of water, take the tube off, and we're gonna push air through the tube just to get the moisture out. You can take the tubes out, and this one on the side, if you can come over here and look at this, you just got to press this button in the back like so to pull it out, and now you have a clean flexiVent and good data. So thank you for coming to the video, and please comment, like, subscribe. Any concerns, questions, criticisms, we would be happy to answer and help you get good data on your flexiVent. Thank you.